Dr. Quinn, you spoke of a specific patient that presented with chest pain. Now, what happened?
Well, this was approximately 6 months ago, and the patient came into the clinic with his wife, and he reported that he was having some chest pain, and he was having it real time, like right at that moment that he was speaking with me. And he was having some rapid breathing, a little bit difficult, and it really worried me. And I explained to the patient that I was going to call the ambulance. And he was like, no, don't. I said, sir, we're going to call the ambulance. And he went to the emergency room and got some diagnostic testing done. It was determined he had a pulmonary embolism. He was rushed to surgery. They removed the blood clots from his lungs, and they told him that his life was saved. So this was an example of chest pain. It was so fortunate that he went to the emergency room in the ambulance, because if he would have ignored it, they informed him that he probably would have lost his life.
Yeah, that is absolutely, it's fortunate that, he went to the emergency room. But what are some other potential causes of chest pain now that you speak of that?
Right. I mean, chest pain, number one, I want the audience to remember you don't want to ignore it, because it could be cardiovascular, such as a heart attack. It could be an aortic aneurysm rupture. It could be a pulmonary embolism like the patient I just spoke of. And then it could be something mild, like a patient I had a little bit earlier, a couple of weeks ago. He had a little chest pain. We did some testing. Everything was negative. We put him on something called a proton pump inhibitor, and he had something called gastric reflux disease, where acid would be expressed through his esophagus, and it gave him a little discomfort. But when we gave him the medication to decrease the acid level, then the chest pain was resolved. So there are many different causes of chest pain, but the take home is you still want to get evaluated by a medical provider, because if it is cardiovascular or pulmonary, it could be deadly, so you don't want to ignore it.
Right. That's good tips. Now, for our viewing audience, just to recap, Dr. Quinn, what is the most important message that you just want them to remember in regards to chest pain?
Well, as I said earlier, I just cannot overemphasize. It's something you don't want to ignore. Now, for senior citizens, in a lot of cases, they can have a actual heart attack or even a stroke, but because maybe they're a little more senior or elderly in their years, their presenting symptoms may be what we call in the medical field as atypical, meaning that it's not the same. For instance, for a younger person, they can have chest pain and it's excruciatingly painful with a heart attack, but a senior citizen, it could be a lot less. So in this case, we also don't want to ignore chest pain and get it checked out.
All right. That was Dr. Timothy Quinn for you. Thanks so much for joining us, Dr. Quinn.